Namaste. Good evening to all, and welcome to yet another session of Gurukula. Today is the 30th episode of Easy Ayurveda Gurukula. Welcome all our participants to this particular episode. So today we have Dr. Kiran SS with us, who will be presenting a very interesting topic. So on behalf of Easy Ayurveda and Family Easy Ayurveda and all the participants, may I take the privilege of extending a cordial welcome to Dr. Kiran SS. Dr. Kiran, namaste and welcome to Easy Ayurveda Gurukula.
Yes, thank you, sir.
So before I hand it over to Dr. Kiran, so I'll introduce Dr. Kiran to all of you. So in brief, Dr. Kiran has completed his undergraduation from the prestigious SKMC Ayurvedic College, Bangalore, and post-graduation, he is pursuing the post-graduation and currently in third year in the Department of Kai Chikitsa, post-graduation Department of Kai Chikitsa, again from yet another prestigious Ayurvedic college, A.L.N. Rao Ayurvedic Medical College, Koppa, Chikmagaluru district, Karnataka. So Dr. Kiran has assisted and conducted various procedures, like he is interested in Agnikarma, Siravyadha and Viddha Karmas, apart from assisting and personally conducting many Panchakarma procedures as a part of the curriculum and out of self-interest and as a part of clinical practice as well. So he has attended the basic life-saving support, BLS, and advanced cardiac life-saving support workshops, CCLS. So has expertise in those also. And Dr. Kiran has undergone hands-on training workshop for chiropractic adjustment and cupping therapy. He's presented a couple of good papers at national and international levels. A few of them being Amshamsha Kalpana and Avarana and Parasurgical. So he's working on the thesis, a randomized comparative clinical study to evaluate the efficacy of Rasnadi Gutika with and without wet cupping therapy in the management of Grudrasi. This was some credentials of Dr. Kiran. Today he is with us to present a topic, a very interesting topic. Hopefully you will have an enjoying learning session. Clinical relevance of Ayurvedic Parasurgical Procedures will be the topic of today. So now I'll hand it over to Dr. Kiran. Dr. Kiran, it's all yours.
Yes, sir. Thank you, sir. Good evening, all. First of all, I would like to thank the entire team of EC Ayurveda for giving me this opportunity to present this topic in their prestigious CME Gurukula, and a special thanks to Dr. Raghuram sir, who has been a source of inspiration and a constant support for us. Clinical relevance of Ayurvedic Parasurgical Procedures. So starting by, the thing is, there is a belief that Ayurveda is a slow-acting science. We delay the result too much. If that was the case, this Ayurveda scheme of medicine would not have survived this test of time. So this is just a parasurgical procedures which enhances the result of our Ayurvedic treatments, so that the time of remission or time of effect of our medicine is enhanced in a much better pace. Introduction, Acharya Sushruta has mentioned 8 types of Ksharakarmas, that is surgical techniques, that is even followed today. These are just techniques. Now, that means even in a surgery, when you are doing any procedures, we will be following these steps. That is, one is Chedana, that is incising, Bhedana, cutting, Lekhana, that is scraping, Vedhya, puncturing, Eshana, probing, Aharana, that is extracting, Visravana is draining, Sivana is suturing. These are the general techniques for surgery. Let it be any surgery, we will be using these techniques for the surgery. The word para means beside or alongside or closely related to. So the word meaning of parasurgical stands for the procedures which has a similarity to surgical procedure, but they are a miniature version of it. For example, an appendicectomy surgery, you can take it as a surgical procedure. The same thing we'll be doing in an I&D procedure, that is incision and drainage, that is in a smaller level. So that can be correlated with parasurgical procedures. The word Anushastra Karma is being used widely for parasurgical procedures in Ayurveda, as well as Anushastras is that are like Shastras. Like the instruments which we'll be using for a bigger surgery won't be used for a smaller surgery. So because of these reasons, parasurgical procedures are also termed as Anushastra Karmas. So where do we get the reference of these procedures? We get the reference of these procedures from mainly Brihatrayis, especially Sushruta has given a better and a deeper understanding of these topics, and we even get in Ashtanga Hridaya and Charaka Samhita also. So the question, why parasurgical procedures are needed? As I said before, the misconception that Ayurveda is a slow acting science. If that was the case, I said now Ayurveda would not have been there. Now after the British invasion, the current scenario, the COVID, after even all these, Ayurveda has crossed this and still leading in front means Ayurveda is should not be a slow acting science. Then the parasurgical procedures have an additional action of quick, that is ashukaritva, quick in action. Like we are giving medicines internally, it takes time to get digest, it goes to all dhatus, digestive process, get absorbed, metabolized, then the result is shown. But whereas in parasurgical procedures, it is not like that. Just after or within a span of half an hour, we'll get to know the difference. So that boosts the confidence of the patient in an Ayurvedic doctor. So it can be done on OP basis with minimal training. It is not necessary that we need a full-fledged IP setup to do these parasurgical procedures. And with minimal training, when compared to other procedures, we can do these parasurgical procedures in an effective way. Then it is more Vaidya-centric. By Vaidya-centric, I mean just by writing a prescription and giving, the patient and our connection won't be in a that much deeper level when we are indulging in a procedure or doing any procedures for the patient. The bond between the patient and the Vaidyas are more strong than just a prescription based bond, and it gives a boost in initial phase. That is when our graduate is starting his practice. At the initial phase, it is hard for him to get the patient to give the result. So when our parasurgical procedure is there, it gives the boost for his initial phase, so that the patient gets the belief that okay, something is working on me, I can continue with this doctor. So it gives that effect on me. With their medicines, it has an additional benefit for patient and doctors also. Patient, they'll get relief quickly. Doctors, it is an additional income for them, not just through medicines. When the patient gets more relief, you can charge for the procedures in a reasonable way. It is not taught extensively with its practical implication as a part of curriculum. That is a main reason why it is not been carried out throughout the students who are passing the Ayurveda, or it is just restricted to a specialty who are dealing with this. It is not a specialty. It can be done by even graduates and postgraduates. And the next is it has utility in pain related issues. We all know that the patients who comes to us is more related with pain. The patient won't come to you and say, sir, I have this some Pura Rupa, so treat me. They will come with pain. Only when a patient gets pain, only they will come and consult you. So when you reduce the pain, then you can go to the level of correcting his dhadus. So first is to reduce his pain. So if these are the good points, why it is not being practiced? So why not parasurgical? The main thing is the inhibition or lack of awareness among both the doctors and the public of such procedures are the main reason why it is not practiced as much. Among doctors, how it is not understood is in a practical way. When, where and how a parasurgical procedure should be done, that is not being taught in the grassroots level in our undergraduation. As a theory curriculum, they will be grazing through the points, but on the practical level, the knowledge has not been delivered to the students. And among the public, normally we'll get patients coming and asking, sir, we need a panchakarma. According to them, panchakarma is just massage, but at least they'll come and ask for that. Nobody will come and ask for you, sir, I have pain, do this Agnikarma or Viddha Karma on me. And once a patient get a result, then the patient will come and ask. Many a times a bystander of a patient will come and ask, sir, you did that Agnikarma for him, he got relief, now you can do it on me. Unless they experience this result, they won't come to us asking for that. Then even though said all things good and right, but still it is an invasive procedure. So there can be chances of complication. So we should be in a condition to reduce the complication and increase the risk and reward ratio. More than risk, precaution should be the better word to be used here. The precaution and reward ratio will be the better word to be used for parasurgical procedures, because if you take the proper kind of precautions, the reward is sure you will get. So by just a brief about this, for disease care, you can take parasurgical as a T20 cricket, which has a faster impact. Whereas, as everybody says, which is a real cricket, that is a test cricket, there comes a role of Panchakarma. You need Panchakarma to reverse the Samprapti Vikatana, to do the Dosha Dusha Vivechana, and to do the Rasayana of the Dhatu, so that the diseases won't come back. So each has its own place. It is nowhere it is said that parasurgical is much above or higher than Panchakarma. There is a quote, Baap Baap hota hai, Beta Beta hota hai. So each has a separate route. The mixture of both should be there in our clinical function, so that the result plus the satisfaction of the patient will be in a better level. So by keeping all the basic concepts of Ama, Nirama, Dosha, Dusha, Agni, Koshta, Vibhajana, we will be moving forward. And disclaimer alert, here we will be just briefly going through the procedures. We won't be seeing the Purva Karma, Pradhana Karma, Paschat Karma, and the complication. We will be just briefly going through what are the procedures and what effect we got. So some parasurgical procedures in Ayurveda. Mainly it is divided into three. One is Agnikarma, next is RaktaMokshana, Ksharakarma. So in this slide, in this PPT, we will be dealing with these. In Agnikarma, the types of Agnikarma, that is Ruksha Agnikarma and Snigdha Agnikarma. What are the different types of Shalakas or cauterization method which has been said, why it has been said. In RaktaMokshana also, why different types of RaktaMokshana has been said, will be dealt in coming slides. Yes, this is Agnikarma. So first thing when Agnikarma comes to our mind is to burn the patient. So we should keep in mind that it is not to burn the patient, it is to transfer the heat to underlying structure. That should be in our mind, not to burn the patient. We want to transfer this heat to the underlying structure so that the patient get relief. So that is the intention for Acharyas mentioning different kinds of shalakas or different kinds of heat transmission. For example, Sushruta has said, Pippali, Aja, Shakrit, Godanda, Shara, Shalakanam in Twaggadana. When are the problem or the diseases in the Twak, we will be using these kinds of mode of heat transmission. And when it is in deeper dhadus, that is Mamsa dhadu, Jampa Oshta and Idara Lohas, that has much more heat transmission, so that it goes deeper. So that was the intention of Acharyas for differentiating the method of heat transmission into the patient. For example, Pippali, on heating, it will be reaching around 57 to 60 degrees Celsius. Whereas Idara Loha, that is Loha Shalaka, it may cross around 228 degrees Celsius. So the heat differs and the nature of the heat differs, not just the temperature. Our sir used to say, we are not Ayurvedic specialists, we are super specialists. So we are transferring heat. Okay, that is specialty. Next is super specialty. We want to see which kind of heat works in which kind of dhatu. So always keep in mind, we are not specialists, we are super specialists. So the first photo, which is a case of facial warts, for that patient, we had given medicine for a week. Okay, the wart had come a little bit, shade has reduced, but still the warts are there. So we had planned to do a Agnikarma with RF cautery. That is a modified cautery which has a small tip through which you can burn the exact area of wart. This is the photo taken on the same day. Because of that, you can see the small edema over that area. Next day, the edema was almost gone and that small crust was formed. After a week, even the crust has gone and normal skin has come. So this is the effect which a patient can get when we are dealing with parasurgical procedures. And the next photo, it was done for tennis elbow. So it is a modified kind of Agnikarma. Normally we'll do is with red hot shalaka, keeping on the area where the tenderness is there. It is inflammation in the lateral epicondylitis. It is also known as lateral epicondylitis. Even Sachin Tendulkar has this disease. So whenever a patient comes with tennis elbow, we can say you can be proud. Even Sachin Tendulkar has this disease. So here, we have gone for another method of Agnikarma, that is through heat transmission. The advantage of here is that it is less invasive. There won't be any marks over the area, but whereas the heat will be transferred to the internal structures, reducing the localized edema, thereby reducing the pain of the patient. So normally some Vaidyas use Swarna Jalauka, but because of cost problem, we had find out another alternative method which is in the shape of that Jalauka. That is 7 centimeters length, 4 mm head thickness, and 2 mm width. So we are using another rod which qualifies this mesh, this said dimensions, and we are getting results. The next one is a patient of Parshni Shula. Parshni Shula means ear sole pain. The patient says whenever she is getting up from the morning, he can't keep the leg at foot at the ground. She has to limp for 2-3 steps, then she can walk. So in this, normally hospital setup, we will be asking the patient to do Ishtika Sveda, that is boiling a big Ishtika and keeping the leg over that, or pouring Dhanyamla and keeping the leg over the Dhanyamla, so that the vapors will be touching that area, so that this shofa will get reduced and the pain will get reduced. But here we have also, there was a modification in that. There is a reference of Mrittika Jalauka. We have a modified Jalauka, that is Mrittika Jalauka. This is made from anthill mud. We wash the anthill mud, we filter it, keep it for a day, remove the supernatant, the sediment portion will be dried for 2 days, then it will be heated on a mild flame, and that becomes like this. This is very good in Parshni Shula when the patient can't come for Ishtika Sveda, or it can be done even in OP setup. The only thing, it can absorb heat and dissipate for a long time. So once you heat, you keep it over the place. Better to use a paper so that there is no direct transmission, so that the heat doesn't go deep and cause a burn on the patient. For that, we will be keeping a paper in between, and when the patient says, yes, this much heat I can tolerate, a little bit more we'll be keeping and we'll be removing it. So that is another method of Agnikarma. The fourth picture, that is a case of corn. It is said that Agnikarma is Apunarbhava. Even I was thinking, if that is the case, once you do Agnikarma, the disease should not recur. But that was not the case. This patient had a corn for more than 3 to 4 years. So first what we'll do, we'll scrape the above tissue, then we'll burn the center part, which is already necrosed or dead. The patient won't be having a sensation. After that, we'll be sending the patient with internal medicine for follow-up. And the next follow-up, again, we'll be assessing the condition. If that pain is there, from below the skin will be growing. So even the root of this corn will be deep inside. So unless we reach that root, the disease won't get cured fully. So it may take 2 to 3 sittings if it is a longer one. If it is a recent one, it may go in the first one only. So once that root is burned off, then that corn won't come in that area. That is the Apunarbhava which Acharyas have mentioned for Agnikarma. It is not like that once you do Agnikarma, that disease won't come. If you do Agnikarma in a proper way, that disease should not come. This is another modified form of Agnikarma by Dr. In SDM, Shalya HOD Dr. Dr. Arjunagi. This was, I got this from his videos and we tried on the patient. This has an additional benefit of the heat will be transferred through the Eranda Patra, through the body of the patient. So there is a heat transmission plus Vatahara action. There is both going on in the patient. So the relaxation or the patient get much faster result. And it can be done in OPD basis. No need for a Panchakarma setup for this. So next, now we have dealt with Ruksha Agnikarma. Next is Snigdha Agnikarma. As Acharya has mentioned, Shaudra Guda Sneha Sira Snayu Sandhi Asti Gadana. So whenever it is in a deeper condition or the disease has traveled from a Kafaja, Pittaja to a Vataja state, where you need Snigdhatva there. So that time we can opt for Snigdha Agnikarma. For that, here the first patient, the first photo is of carpal tunnel syndrome. The patient complains of numbness over the first 3 fingers and he can't start the vehicle or turn the key. This motion was hard for him. There was a mild tingling sensation. So we had given the internal medicine. After the first visit, he said, okay, I am getting a relief of 30%. Then we thought, okay, then we can try with this Snigdha Agnikarma. So here what we had done is we had heated the honey and we had first palpated the area where there was maximum tenderness, where the carpal tunnel is located. Over that area, we had kept small drops of Kshaudra, so that the heat get transmitted deep into the area and without causing any burns, their local inflammation is reduced. So this is also a method by which we can do Agnikarma without causing burn. So keep in mind, Agnikarma is not to burn the tissue, it's to transfer the heat. The similar is the case of the third one, that neck photo. That was a case of acute neck spasm due to Vishamasana, that is irregular posture, that we get more frequently in students also and other patients also. Yesterday night I slept somehow, sir, now I can't turn my neck. They'll be in a kind of spasm. So that here only external medication was given. First what we did, we can see the round marks. That is a mark of cupping mark. That is a dry cupping was done, so that blood circulation to that area becomes better. And after dry cupping, we had asked the patient, how is the pain? He said, I'm much better, a 30% relief has come. Okay, then on that we had done the Kshaudra Agnikarma, which we had done on the CTS patient. After doing Kshaudra Agnikarma, he was saying, sir, that heat I can feel it is going deep. Then I have got a doubt, will it burn or not? First I removed a few drops. It was there was no burn marks. And before keeping the Kshaudra, it is must required to check the temperature. It should not burn the person's skin. So for that, you can try on yourself on the same surface, on the softer side of your palm, not on the palmar surface. Then you can put on the patient. The center photo, that is for Gridrasi. That is also a kind of Snigdha Agnikarma made popular by Ravishankar sir, Parvaji sir, Puttur. Here what we'll be doing, we'll be taking oil and we'll be adding Vatahara drugs, leaves, in a generous amount of oil. Oil should not be less. In that, we'll be adding Eranda Patra or your Arka Patra or Nirgundi Patra. Any of the Vatahara drugs are okay. Then we'll be heating it. The oil should be covering the leaves. Otherwise, the leaves get charred and we won't get the effect. So it should be in a semi-liquid condition. After heating it, and one more thing, while heating, there are chances of it catching fire. No need to worry. You can remove it from the flame. It will get off. Don't sprinkle water. It will burn more. So after doing that, before only the patient's parts are prepared, the tender points are elicited. It will be marked, exposing which part we have to do. Then this heated oil with Vatahara drugs will be taken on another bigger Eranda Patra, not only one or two, so that it doesn't leak. We don't want this oil to touch his body directly. Through this Eranda Patra or Vatahara Patra, that heat should go inside. Same thing while pressing down to take care of our fingers. If our fingers go inside, you don't want to have a blister on your thumb on the next day treating a sciatica case. For that, we'll be keeping a coin on top of that. Then we'll be pressing and leaving that area in a faster pace, so that there won't be a deeper burn. Some cases we'll get a small redness or a small tinge. That will be said priorly to the patient. This thing can happen. If the patient is ready, then only we'll be going for this. Yes, the golden rule of Ayurveda, never bypass the doshas. The three photos, disease is the same. The disease is Parshnishnulla or heel pain, but the treatment is different. So why that is there? As our lecturers used to say, we are not specialist, super specialist. If we are just specialist, this is all our heel pain. Now we are becoming super specialist. So we will be seeing which dosha is in the disease, which dosha is more predominant. Just I'm giving a glimpse, not only in the local area, in full body, you should assess the dosha, how that dosha reached that part and made that disease. That should be kept in mind. Whatever the parasurgical procedures we'll be doing, with that we'll be giving additional medicines, so that the samprapti vikatana happens simultaneously inside the body also. These are just for relieving the pain of the patient and for the medicine to reach that area much effectively. First case is of Kevala Vadaja, that the patient, instead of doing Ishtika Sveda, that is a more better way which I got from another lecture. The green husk of coconut that will be heated on a flame. Better to take green husk, not rather than dry, because it has some oilness in this. And then apply Vadahara Tailas on the foot. Then keep the foot on the heated husk. So that is for Kevala Vadaja Parshni. The second one, there was a tinge of Pittaja involvement. Like patient was having, sir, with the pain, I am having a burning sensation or a daha kind of feeling. So there, first only doing Agnikarma may not provide us with that much relief. So first we will be dealing with the Pitta dosha by removing the Rakta from it. Then we next sitting, if there is any pain, then we will be doing the Agnikarma. Next, the last one is for Kafaja, where the patient was exactly saying patient is having stiffness associated with pain. There we had done directly the Ruksha Agnikarma. So next, RaktaMokshana, broadly classified into Sashastra and Ashastra. Sashastra is divided into Siravyadha and Prachanna. Ashastra is divided into Jalauka, Shringa, Ghati and Alabu. These are the methods by which blood can be removed from your body. Siravyadha, in Kaya Chikitsa, Basti is considered as the Artha Chikitsa. All other treatment one side and Basti one side should weigh equally. So that much is the importance of Basti in Kaya Chikitsa. Similarly, in Chalya Tantra, RaktaMokshana has a similar role there, because Ushruta has considered Rakta as the Chaturtha dosha. So whenever a disease is not getting relieved from your Snigdha Ushna treatment or Ruksha Snigdha treatment, then we have to infer that the doshas has reached the Rakta Dhatu and there is a Rakta Visheshan. Then we have to go think about RaktaMokshana. So one form of RaktaMokshana is Siravyadha. The first photo, the patient was of Gridrasi. She was complaining of radiating pain, and a peculiar character what she was saying is that whenever she get pain, the veins get bulged there. She can feel the pulsation feeling in the veins. That was a clear-cut indication of doing Siravyadha, where we can understand the doshas has reached the Rakta and it is trying to get out or trying to subside somehow. So first, during the admission, we had said the patient, but the patient said I was reluctant to get pricked. Okay, then on day by day goes on a little bit. The patient also was getting a relief by small parameters, not in a higher level. Then after the third day, the person was also okay to get Siravyadha done. So we accompanied the patient, and first thing in Siravyadha, before doing Siravyadha, whatever the mechanism or whatever the procedures we are doing, there will be three stages: Purva Karma, Pradhana Karma, Paschat Karma. The Purva Karma and Paschat Karma are as much important as the Pradhana Karma, so that there won't be any complication. Why I said this is because before Siravyadha, in Purva Karma, we have to give Snigdha Yusha, so that there won't be any Vata Prakopa after the RaktaMokshana has come. So now I won't be dealing with each step. I will be just discussing what was the procedure and what effect the patient got. Yes, so she obliged to do the procedure. We did the Siravyadha almost 250 or 200 below 150 ml came. The same patient who was reluctant to do the Siravyadha, when we accompanied her back to the her room, before sitting on the cot, she was asking, sir, when are we doing the next leg? That was a relief which she got from this. That was the effect which it had on her. Again, I am repeating, the Samprapti Vikatana which happened in her body has not been changed. There is just a relief in the patient, but the patient now has more trust in the doctor and will do the things or patya which we say to them in a proper way. Similar was the case of Vishwachi, where the pain was radiating from neck to the fingers. The patient was given Snigdha Yusha, then Siravyadha was done. Next is an interesting one. It is Viddha Karma. It is a miniature form of Siravyadha. There is no correct reference like Viddha Karma you should do. When reading Siravyadha, it was made popular by Vaidya R.B. Gokte sir. Is from Pune. And now Chandrakumar Deshmukh sir is propagating this in a better way to many of the students. So in Sushruta Sharira, 8th chapter, he has mentioned the points where all you should do Siravyadha. For example, if Nasa Roge, Nasa Mule Vidye. So Acharya has said to do Siravyadha at the tip. So in all knows that we can't find any vein over here. It is not a classical Siravyadha which we saw before. What we have to do here. So here, instead of that, we will be using a 26 into half mm insulin needle, and we will be pricking the spot which has been said by Acharyas for a particular disease. And the difference for Agnikarma and Viddha Karma is Agnikarma, Atyagra Ruje, wherever Atyagra Ruje is there, you can do Agnikarma, keeping the mind of Pitta in mind. Whereas Viddha Karma, you can't do, okay, their pain is there, I'll do Viddha Karma. There are specific points where you should do, then only you will get a better result. I'm not saying, okay, patient has pain, you did Viddha there. There will be a elimination of little bit Rakta and a little bit Vata. Patient may get relief. But Viddha Karma, there are specific points where you should do, that is mentioned in Sushruta Sharira for Siravyadha. That same point we will be doing Viddha Karma. Based on the points, the depth of the Viddha is also mentioned. Like if it is in Tvak, it is Ardha Vrihi. Vrihi means a rice, which is shown in the photo. So 26 into half inch needle almost comes in that length. So if it is in Tvak, we will be inserting half of it. That is about 2 to 4 mm. If it is in a Mamsala Pradesha, then we will be inserting a Vrihi, that is full for 4 mm. Next, we will be using 24 mm gauge needle who are Staulya. The same point, if the patient is Staulya, if you want to reach till that, we want to use a little bit lengthier needle. For that, we will be using 24 number needle. So based on the position also, they have said how much depth we should prick. So again, I am repeating, speciality or super speciality Ayurveda, we should still ponder on it. And here, Ruja Samprapti. Okay, the patient is complaining of pain and you go and do Viddha there. You may not get relief. That time we should assess why the patient got pain. For example, is it because of a Nija Dosha Visheshan, then Vata Prakopa happened, then Rakta Visheshan happened, then the pain came. If that is the condition, no problem. You can do the points said in the disease, what all points are specified. But on the contrary, there was an Abhigata. Whenever Abhigata happen, there will be a Rakta Visheshan leading to Dosha Visheshan, leading to pain. So in the both cases, there is pain, but the Samprapti is different. So based on the Samprapti, we will be selecting the points for Viddha Karma. So if it is a Raktaja Visheshan Samprapti, first we will be doing in the point set for Vata Rakta. That is 2 angula above Kshipra Marma. Not on the Marma, 2 angulas above Kshipra Marma. Then we will be going for the points specified there. The first photo, it is for renal colic pain associated with stone. We had almost, I don't have a large number of patients. I think I have for 4 patients. In that, 1 patient didn't allow to do fully. He was not cooperative. Other 2 patients, it is said that which side you have pain, on the opposite side you should do the Viddha. And the patient who came for follow-up, he had a scan report, he had a stone on the left side, so we had done on the right side. So after we came out of the OPD, the patient came and said, now there is a relief of 30% of pain. That doesn't mean that stone has dislodged from there. Still the Samprapti of stone formation and stone is there, but his symptom has reduced in a much faster rate. So imagine you are giving internal medicine and you want to get this result. And imagine doing this parasurgical procedures and getting the result. That is a difference. But even with parasurgical procedures, it is must that you have to give internal medicines. The next patient is of headache. Even after taking analgesics, the patient was having severe headache. And the same symptom he was saying, these veins are getting enlarged. I can feel the pulsation. Actually, should have done Siravyadha from there, but not that much confident. So instead of Siravyadha, the points said for Shirashula has been done. That is Bhrumadhya, Lalata, Apanga and Upanasika. It was done on both sides. I did the procedure, came out, went back to ask how is he, the patient was sleeping. That was the impact it had. Point to be noted, second day the patient got the pain again. So I'm saying that there may be relapse. Then after giving that it was repeated for 2 to 3 days on an alternative day basis. Then the pain came reducing. Then after starting Nasya and all, the patient got a much better relief. But that faster effect we got with this procedure. Even for a patient of Shvasa, that recently, I think 3 months back, a female patient around age 35 came with wheezing problem. Sir, I want injection or inhaler. So while writing only, we are thinking what we can do. Then thought of Viddha Karma. For Shvasa, there are points which is said, that is Kaninika Angushta Madhya. The point 1 is here, and on the medial side of Kurpara Sandhi, 4 angulas above and below, and 1 more point in the medial 2/3 and lateral 1/3 below the clavicle. So these 3 points, Viddha Karma was done. So before doing Viddha Karma, we had auscultated the patient. We could hear the repeters. We couldn't hear the Gurgur sound. After doing Viddha, after I think it took 1 minute. Around 1 minute, we again auscultated the patient. Before auscultation only, we can see the patient who was gasping for breath was okay. Now I can try with some internal medicine rather injection. When we auscultated, the crepitus has reduced in a very significant level. Then internal medicines was continued. Yes, next, cupping therapy. This is one of indication of Ayurveda in sports medicine. The first one is Michael Phelps, the famous swimmer, and all they are sport persons who are using the parasurgical procedures for getting a faster and efficient result. So cupping therapy, it can be taken as Shringa or Alabu. It is of 2 types, dry and wet. Dry cupping we can do whenever there is a muscle spasm. We can add one more additional impact to it, what the photo shows, that is fire cupping, so that there will be a Ushnatva in that vacuum. So that will be done from an insertion to origin of a muscle to release any muscle spasm, or there is a trigger point. You release a trigger point, the muscle will be normal, the range of motion improves. So even if you don't have a cupping apparatus, we Indians are known for jugaad things. You can cut the top out of the syringe and put it ulta and reverse and pull that. But only problem, you have to hold it for a long time. So better you ask a bystander to do that. Otherwise tomorrow we'll be getting hand pain. So these are the apparatus what we'll use for cupping therapy. A sterile apparatus, sterile gloves, number 22 needle, and the cup shape according to the area, and the photo of that leg, that photo of the second photo and third photo, the face photo and leg photo, both patient is of same patient. He had came to us, he said, sir, recently I have bitten by a dog. So I was asking, okay, you took anti-rabies? Yes, I have taken anti-rabies, but itching is not reducing. So the patient wanted to do cupping there. So I was not ready for that. Why do you want to cupping there? Sir, that Dushita Rakta will come, I will get relief. Okay, that patient insisted. Okay, then we did cupping there. Before doing a wet cupping, we will be keeping a dry cup. Then after removing the dry cup, we will be keeping a small slashes, superficial scratches. Then we will be keeping again the cup. So before we did the superficial scratches, the bite point, those 2 were the bite points of the dog. There was a serous kind of fluid which was oozing before we did the wet cupping. So after when we did the wet cupping, and the patient also had pimples, so he only insisted that I want for pimples also. Whenever we are doing in face, better not to go for a thicker needle, thinner needle will be better. Even your barber's blade also is better, given the fact it is sterilized. A fresh one. This is a patient where the range of motion has improved before and after cupping. Next is Jalauka, Avagade Jalauka Syat. Whenever it is deep seated, whenever there is a Pitta and Rakta vitiated, we will go for Jalauka Vacharna. The first was a patient of eczema. The second patient was of a Dushtavrana. Even after medicine, the wound was not healing up to a greater extent. So we had planned for Jalauka. It has an additional effect that hyaluron in the Jalauka improves the blood circulation there. And it also activates your immune system so that the healing occurs faster. The third photo is of Mukhadushika, that is pimples. By the color only we can understand that it is red, and it is of Pittaja in nature. So wherever there is Rakta and Pitta vitiation, if it is superficial, we can go for Jalauka. So this is a patient who came for Dushtavrana. With internal medicine, with external medicine, we had given one sitting of Jalauka for this patient. Then this during the treatment and after follow-up, like after she has discharged and then after 15 days she has come, that is the result which we got with internal medicine and Jalauka and Dharas. So the last one is Ksharakarma, Shastra, Kshara. In all these Shastra and Shastra, Kshara is said as the Pradhanatama. So normally we will use only for anorectal region, but in other places also it has shown efficacy, especially in Nasa Arsha and even in recurrent tonsillitis, we can use Ksharakarma. So the conclusion, I would like to conclude that with internal medicines and other Panchakarma modalities, we can make use of parasurgical measures wisely to get the maximum and fastest impact for the patient, keeping in mind for pre-post procedures to avoid possible complications. There are still hidden treasures in Ayurveda that is yet to be used to its maximum potential. The golden rule, never bypass the dosha. Let's share the knowledge and grow together. Thank you so much.
So well, it's time for me to tell a big thank you to Dr. Kiran. A wonderful, exhaustive presentation where it was a clean blend of theory, practice, the practical implications and everything. If you don't do these things, things doesn't come just like that in a flawless way like Dr. Kiran was presenting. So it also looked like it was not a presentation, but being in post-graduation, that is the third year. So this approach, the method of presentation, the way Dr. Kiran explained, I felt this is a miniature teaching methodology. So that was really awesome. So the content of the slides also was simply awesome. So like I think most of our participants or easier with the family would agree with me if I'm not over like exaggerating this. So I would like to also tell our participants that Dr. Kiran belongs to the Department of Kaya Chikitsa, which is often compared to the general medicine. So but what he was presenting was totally different. Moreover, the parasurgical and surgical aspects. So the specialization he is doing is in general medicine. So this shows that there are no barriers. Like maybe the higher tiers of the education might have classified these things in the post-graduation, like we have post-graduation in Shalya, so which is surgery, in Kaya Chikitsa, that is general medicine, in Kaumara Bhrutya, that is pediatrics. So there are so many wings, but there is no restriction that, or there is no inhibition, only the thirst and hunger to learn and learn more. We'll go to the couple of questions in the question box, Dr. Kiran. First of all, where should this training and the courage factor be implemented to the students, at the UG level or at the PG level? Where do the students get the courage of doing the surgical and parasurgical methods, being Ayurveda physicians? And where exactly do you think as a student, because you have the journey of being a UG student, a practitioner, a PG student, and next you will go and become a teacher and a student, where all these things should be plugged in into the student's mind, and what is the correct point of creating confidence in the student's mind to implement the parasurgical procedures in their clinical practice, immaterial whether they belong to the Shalya, Shalakya or Kaya Chikitsa. Over to you.
Sir, better to start from the UG level only rather than specializing when they go for Shalya. There are classes for practical classes which there will be demonstration of how class taking should be there, how a case study will be there. One class of that, take it for a parasurgical procedures. Let the students do on themselves if it is not an too much severe one, like a dry cupping or any marma techniques. What the students can do on themselves can be a more boost for them, or they'll get a more confidence on them, so that after this thing I can do something for that for that patient, so that there will be a more relief for them. And one period, or there is some cases a fellowship for parasurgical procedures is also an option. How our modern science are doing, like a separate scheme training that. But better than that, from UG's time only, sir, in internship time, when there is procedures, let them come and see. More than let them come and see, if you make them do, then the confidence which they'll get is enormous. We have seen 100 number of Agnikarma, but doing Agnikarma gives much more confidence in them. So if that kind of system or scheme comes in front, it will be a much beneficial, sir.
Absolutely. From the student's perspective, it is a very important point that you made. You also mentioned Vaidya-centric right at the beginning. And a lot of these things brought into, and we also know that there was Ashtanga Hrudayam, which was introduced to the UG students right at the beginning. Now there are Samhitas, so like a blend of Samhitas everywhere. But having said that, the student should go and read the Samhitas. So when they're reading Ashtanga Hrudaya, so we have Ksharakarma, Agnikarma as chapters there also, and any Samhita they're reading. So especially Sushruta and other things, we have a blend according to the NCISM syllabus now. If the students are immediately taken to the practical sessions, maybe half an hour, 45 minutes, or something is demonstrated in the classroom with the patient on hand. So hands on the patient with the equipments in hand. So that will build up a lot of confidence. That is definitely going to be a game changer for the students to go out and practice with utmost confidence in their clinical practice. So having said that, I'd like to take a question from the question box. Prajnaji asked, Doctor, where we can use pippali for Agnikarma?
Sir, pippali has much better result in bursitis than other Tvak related thing. We had got better result in calcaneal bursitis. There pippali has shown better result because of the Tikshnatva, the bursitis reduces much faster. But only thing to keep in mind that because when we burn pippali, the dry pippali, there are chances that some of the coal like or the fire, it will be there in that. So once you keep and remove, if a fire particle is there on the skin, it causes a burn. So one thing to keep in mind that should not happen. Or we'll get a processed pippali, you can do mardana and then make into a varti, how this varti is made. Similarly, you can make pippali varti so that this complication can be avoided.
Thank you there, Prajnaji. So I think that clarifies your question. I'd like to give a small clarification on the basis of what Dr. Kiran explained. Pippali is piperlongum and it will have small granules, and the distribution of the heat may not be even to all those granules, and there may be some fire, like active fire left out in the granules or in between, that may cause severe burning or overburning. We call it as atitagda. To avoid that, you can make it into a paste or powder it and convert into a paste and prepare some suppository like thing what Dr. Kiran showed, and that can be used for Viddha Karma, so that we'll be giving like what we can call it as a balanced heat to that particular situation. Having said that, Dr. Kiran, is it the pippali as a material of Agnikarma which is working there, or pippali as a herb and its properties? The properties of pippali are also working in that situation.
Yes, sir. The properties. Only there was a reference of different Agnikarmas. So it is not just the heat. There is an additional property of the dravya which you use. There is a difference between Rukshasveda and Snigdhasveda. Similarly, there is a difference between pippali which has the Tikshnatva in that. So with that additional property, it reaches more deeper, or it gives results in a much better way than just the heat.
Okay, thank you there. And you also mentioned that pippali is preferably used in bursitis related to the calcaneum and the foot region. So why was that? So like if we can use it in other places, like you mentioned the pain of tennis elbow, or in some painful situations, or when ama or something is there like a bursitis somewhere else, does it mean to tell that those places of the body will not tolerate the heat, or this has been only experimented on the calcaneum?
No, sir. It is not like that. It won't tolerate, but we had got better results on bursitis than on the other sides. And I wanted to mention one more thing. Because of enthusiasm, many times we have crossed that ama nirama avastha. So once that Agnikarma or the parasurgical procedures are done, after attaining the nirama avastha, the result is much better when compared to Samavastha. By saying this, I don't mean that starting you should not do, but you can say starting the patient, I will be giving you the internal medicine, but after 1 week there is a procedure, by that you will get a relief, so that you can make a suspense in the patient. And when you do that, there will be an additional effect. So whenever we are doing, we have to keep the basics of ama, nirama, and then only we will be doing the Agnikarma. And pippali, we got better results in bursitis only, sir. Other places, we used the other shalakas, which was much more easy for us to do.
Okay, thank you there. So we'll take one more question from Pradnaji. Doctor, is the Ksharakarma done for nasal polyps as well?
Yes, I have not done it myself, but there are doctors who are doing Ksharakarma for nasal polyp, and not only Ksharakarma, this Bibitaki oil after heating the Ballataka, sorry, after heating the Ballataka, the oil will be smudged on the cotton, and then that oil will be applied on the nasal polyp, and that causes the shrinkage. So that has been done, but personally I have not done that. Kshara part I have not done,
Okay,
but
thank you there.
there are Vaidyas who are using it.
Okay, thank you there, Dr. Kiran. Bibitaki you mentioned. So is there a reference like we should be using Bibitaki or pippali, or is it like again it's over a period of practice that the information has passed on from generation to generation?
Sir, pippali has been mentioned in our classics, like pippali, Ajashakrit, that has been mentioned. Bibitaki, didn't get any classical reference. I got it from a Vaidya who was using.
Jay Raghuji, I think, gives some compliments. Namaste, thank you for the nice presentation. I want to know what would be the Paschat Karma. I know you touched about Puro Karma. What is the Paschat Karma of these procedures?
Paschat Karma, so that there should not be a chance of infection there. So even after doing Agni Karma, we won't be doing a tight bandage, because the tight bandaging of a Dagda Vrana is not indicated in our Shastra. So we'll be keeping cotton pad and just keeping a loose bandage over that. Similarly, in after cupping therapy, we will be cleaning the site with betadine solution, and we will be covering that area with a gauze pad and keeping it for 1 day and asking the patient to remove on the next day. So that post procedures, we will be doing the procedure in a aseptic precaution, but after going from there, if there is an entry of any external factor, it can also lead to a infection. So to avoid that, these are the post procedures which normally we will be taking care of.
Okay, thank you there, Dr. Kiran. And yeah, Sandyji has a question. Namaste, sir. What are the indications of cupping therapy?
Actually, it has a wide range of indication. Even Chinese medicine, they have specific points where all you can do cupping therapy and which all system that can have an effect. But here normally we will do whenever there is a muscle tenderness, or we think there is a recta vitiation, superficial recta vitiation, or we think there is tenderness to the muscle, or there is a trigger point, so that the muscle is not relaxed and causing a spasm. That areas we will be doing. But there are specific points like 1 and 22 on the neck. That is a overall point which you can use for all disease. And then for sciatica on the sacrum region 11, 12 and 11, 12, 13, that points are specified not in our Shastras. But as Sushrita has only said, Eka Shastra Adhyayana, it should not be done. We can take from other Shastras also and implement in here.
Right. So well said. We should not be taking the information available in only one science. So the world is big. So information is available, knowledge is available everywhere. We should be broad-minded to accept that. Having said that, Dr. Kiran, we in Agnikarma also have Gati Yantra and Alabu administration, okay, which are almost similar to the cupping therapy itself.
Yes, sir.
So do you tell that this cupping therapy and the other therapies, similar therapies, have been derived from Gati Yantra and Alabu, which has been mentioned in Ayurveda text? Because many Ayurveda people, they don't believe cupping as a therapy. And you have also mentioned that you have taken it for your post-graduation studies.
Yes, sir. It is a mode of Sringa only, sir. Sringa or Alabu. It is a mode of that only. Just that name is cupping therapy. Actually, the name should be Alabu therapy or Sringa therapy. So it is not like that. It is not mentioned here. It is not Chinese medicine. It is mentioned here the same procedure. Only the name of cup, or that time this plastic or polyester cup was not available. They were using the things what were available for them. Now, due to the advancement of the machineries and the raw materials, they have made it into a cup, sir. So it has derived from that time.
Right. So even Gati Yantra is a similar apparatus which uses suction. So this and Alabu, they work on the suction. And Sringa, I think it should be manually sucked, and Gati Yantra and Alabu are naturally they are sucking due to the vacuum which has been created inside.
Yes, sir.
But cup therapy, has it been like accepted by Ayurveda, because you used it in the title of your thesis? Is it okay to use cupping therapy? So that particular term, has it been accepted by the universities and Ayurveda?
Sir, before keeping the this ready, we had asked 2-3 lecturers like, should we use any other name? So there were study which has already been done in this. Like my co-guide who has done this Vata Kantaka. For Vata Kantaka, he has done cupping therapy. His research was on that. So there was this thesis which has been done in the same name for an Ayurvedic disease. So this was chosen, sir.
So that is permissible and allowed. Okay. So that
Yes,
shows
sir.
that since the works are being done, so it's allowed, and
Yes, sir.
so because it is allowed because it is a variant of an Ayurveda therapy.
Yes, sir. Yes, sir.
Okay, thanks there for the clarification. Lakshmi Sriramji tells it's a very informative session. Thank you, Lakshmi ji. Jai Raghuji, what precautions one should take before doing Agnikarma?
First, we should think about the patient. Like if the patient is too much hesitant or too much, there is a chances of any shock, who is very hesitant to even take a prick, that patients should be avoided, and there are arhas and anarhas for Agnikarma also. So by keeping those things in mind, then only we'll be selecting the patient.
Okay, thank you there. So Arha and Anarha means the eligibility and non-eligibility. Who fits like so indications and contraindications we can take. So that is what Dr. Kiran was mentioning. Indications and contraindications for every therapy is clearly mentioned in Ayurveda. We need to look into that before selecting the patient. Dr. Mahesh MP. So it is seen that like earbuds like Nasa Varti is prepared with yoga made and is being used for nasal polyps, especially by Dr. Sunandan in Chennai. It is a touch on polyps one side with specific time gap for a day is found very nice. Okay, thanks for that information, Dr. Mahesh. So these are for the nasal polyps. So similar things what Dr. Kiran was telling, some Varti means like suppository like things, small things are prepared, they're heated, and the heat is applied to the nasal polyps in this therapy. Thanks for that information, Dr. Mahesh. And Abdul Karim sir mentions cupping therapy is mentioned in Islamic culture as hijama. Yes, right. It is also practiced under the name hijama. Many people claim so even that it is a hijama therapy itself. So that's an information to be added. There are 17 points are mentioned in hijama to activate the whole body and rejuvenate and purify the body as detox. Again, vital information given by Abdul Karim sir. Thank you, sir. There, Jai Raghuji, are there points for Agnikarma too mentioned? Will it matter if it touches a nerve, etc.? A very important question, Dr. Kiran.
Sir, there is no specific point for Agnikarma mentioned as such in Brihatrais, but they have said Atyagra Ruje, wherever there is too much pain, you can do on the part. But keeping that in mind, it should not be too much hot that it will go that much deep to the nerves and infect it. And same time, there should be a thought of back of our head that there can be vitiation of pitta. Whenever there is a vitiation of pitta, better to avoid Agnikarma and do your Viddha Karma or cupping therapy. But the point for Agnikarma, they have not mentioned particular points, sir. Atyagra Ruje, wherever there is Atyagra Ruje, you can do. But for whereas in Viddha Karma, it is specifically mentioned for Siravyadha, what all the points should be followed.
Okay, thank you there, Dr. Kiran. Yeah, Siravyadha is a vein puncture and the bloodletting therapy, where specific indications which vein should be cut, where it should be cut, in what proportion has been clearly mentioned. Whereas when we speak about Agnikarma, that has not been specified where exactly it should be done and how much. As Dr. Kiran said, one indication is Atyagra Ruja, so where there is severe pain, so we can take that. And very importantly, the anatomical understanding is very, very important. The anatomical understanding and the marma concept explained by Sushruta. So there is an extensive discussion of marma points by Sushruta in the Sushruta Sharirasthana. Those things also should be taken into consideration. A thorough knowledge of anatomy, that is Sharira, physiology, that is again Kriya Sharira, and the Marma Vijnana will help the physicians in successfully and courageously handling these parasurgical measures. We shall end this session here with a big cheer and with a big thanks to Dr. Kiran on behalf of all of us, the participants, Easy Ayurveda and team Easy Ayurveda. I would like to extend a cordial thanks to Dr. Kiran for presentation of such a wonderful topic.
Thank you, sir.
So until we meet up in the next Gurukula session, a big thanks and loads of love from Easy Ayurveda to all of you. Thank you and namaste.